5 continued, Table 5.2, Summary of Recommendations for the Handling and Processing of Blood Specimens. Basic Rules of Thumb. Pre-centrifugation refers to specimen handling and processing after collection and before centrifugation. Not all specimens require centrifugation. Tubes with additives should be gently inverted 5 to 10 times at the patient's bedside to mix the specimen with the additive as soon as the specimen is withdrawn. Excessive agitation causes hemolysis. Specimens without anticoagulant additives, or serum specimens, should be clotted before centrifugation, which usually takes 30 to 60 minutes at room temperature. Clotting time is affected, often delayed, by anticoagulant therapy / medications that the patient may be taking. Chilling 2 to 8 degrees Celsius the specimen will delay clotting. Clotting may be accelerated with the use of activators or accelerators. Anticoagulated specimens or plasma specimens can be centrifuged immediately after collection. Serum or plasma should be removed from cells as soon as possible. In general, this should be no more than 2 hours after the time of the collection unless there is documentation that longer contact times do not affect test results. Some constituents are thermolabile. That is, they degrade if exposed to warm temperatures, so they need to be chilled immediately. Chilling a specimen stabilizes most constituents. If potassium is being tested, the specimen cannot be chilled for more than 2 hours because this causes potassium to leak out of the cells, causing a false elevation. Specimens for testing electrolytes, including potassium, should not be chilled. Specimens that require chilling are ammonia, catecholamines, gastrin, lactic acid, parathyroid hormone, and pyruvate. Tests for RNA-based molecular tests can be temporarily stored at 4 degrees Celsius if they cannot be tested within 48 hours. Conversely, some tests require maintenance at normal body temperature until tested. These include cold agglutinins and cyrofibrinogen. Some analytes are photosensitive or sensitive to light, and they should be wrapped with aluminum foil or placed in an amber specimen container to shield the specimen from light. Tubes should be kept closed at all times. Photosensitive analytes include bilirubin, vitamins A and B6, beta-carotene, and porphyrins. Centrifugation refers to a specimen handling and processing procedure in which the specimen is spun rapidly to separate cells from the liquid portion of blood. The manufacturer's specifications generally indicate that the speeds and times of centrifugation. Blood specimens should be allowed to clot before centrifugation. Tubes should be centrifuged with closures, stoppers in place. The centrifuge should have a top that secures appropriately. Because centrifuges generate internal heat, they should be temperature controlled at 20 to 22 degrees Celsius, and for analytes that are temperature sensitive, specimens should be centrifuged in a temperature controlled centrifuge and separated from the cells at 4 degrees Celsius. Specimens, especially those for potassium measurements, should not be centrifuged more than twice. Many types of gel and non-gel devices are available to enable a barrier to form between the serum/plasma and the blood clot/cells during centrifugation. They all have particular viscosity and a specific gravity that is between those of the clot/cells and the serum/plasma. They may be incorporated into the tube as an additive, or they may be added just before centrifugation. Whatever the case, the manufacturer's directions should be followed. Post-centrifugation refers to specimen handling / processing after centrifugation and prior to removal of serum or plasma. Again, serum or plasma should be physically separated from cells as soon as possible. Separated serum/plasma should remain at room temperature for no longer than 8 hours, and if testing cannot be completed within 8 hours, it should be refrigerated at 2 to 8 degrees Celsius. If testing is not completed within 48 hours, the separated serum/plasma should be frozen at or below -20 degrees Celsius unless the assay-specific directions indicate an alternative method of storage. Serum/plasma should not be repeatedly frozen or thawed. When thawed, it should be at room temperature without the use of heat and inverted 10 to 20 times. Frost-free freezers are not suitable for storage because of temperature variances. Serum plasma may be left in contact with a gel barrier or separator device as recommended by their respective manufacturers. Tubes should be stored in an upright position with an airtight, secure closure to avoid contamination, evaporation, changes in concentration, accidental spills, and/or the creation of aerosols. Plunger-type filters are sometimes used after centrifugation to separate serum/plasma from clot/cells before or after centrifugation. Use the correct size plunger for the tube size and consult the manufacturer's instruction for the details and limitations of use. This concludes Table 5.2.